Hello, everybody. Welcome to our last lecture for Chapter 15. Then we'll only have one lecture left, and that's Chapter 6, or one chapter left, not lecture. That will be Chapter 16. So in this last lecture of 15, we're going to look at how we maintain acid-base balance, and then we're going to look at some changes that occur from production of our urinary system all the way through developmental changes as we age. So blood pH has to be maintained between 7.35 and 7.45. Anything below 7.35 is called acidosis. That's when we have a high number of hydrogen ions and a very low pH. Anything above 7.45 is called alkalosis, and that is where we have a low level of hydrogen ions, and so a very high pH. So acidosis, physiological acidosis, is between 7.0 and 7.35. And so we typically have to worry more about acidosis than alkalosis. You don't have a lot of people coming in with alkalosis, though it can be a problem. And we'll talk briefly about it. So how do we maintain our acid and base balance? So our kidneys are one of the major organs that help in maintaining acid-base balance, but our respiratory system and we have buffer systems in the blood also help in maintaining acid-base balance. So blood buffers. Let's look at these really quick. An acid is also known as a proton donor. And so here we have an acid, hydrochloric acid. Hydrochloric acid will immediately dissociate into hydrogen ions, which are acidic, and it lowers our pH of our blood. Bases are proton acceptors, and so this is bicarbonate, which is a base, and when it dissociates, this is not a base. This is carbonic acid. And when carbonic acid dissociates, it produces hydrogen ions and these little bases called bicarbonate ions. A weak acid is going to produce more bicarbonate ions than it will hydrogen ions, whereas a strong acid is going to dissociate completely. All right, so let's look how our buffers work, or our acids and bases work. Molecules always want to, or are going to react, a buffer is going to react to changes in, or to extreme changes in the amount of hydrogen ions in a system. And so if we have more hydrogen ions, so our pH drops, then we're going to have molecules binding to those hydrogens to bring that pH back up. And if our pH starts to rise, we're going to release those hydrogens. There are three major buffer systems. The one you see over here is this bicarbonate carbonic acid buffer system. And so here's an example. Carbon dioxide comes in. Carbon dioxide binds with water, producing carbonic acid. Carbonic acid then can dissociate into a bicarbonate and hydrogen ions. And when it does, it can actually lower our pH. But if our pH starts to lower too much, the bicarbonate can actually bind back to the hydrogen ion, producing that carbonic acid, which can dissociate back into carbon dioxide and water. And we can get rid of that carbon dioxide. So, and I just talked about this, but carbonic acid, so the bicarbonate buffer system is a mixture of carbonic acid and sodium bicarbonate. Carbonic acid is a weak acid. bicarbonate ions then react with strong acids to change them to weak acids. That's what their job is, okay? And so here we have hydrochloric acid, we have this sodium bicarbonate, and then we produce this weak acid and salt. Here's a strong base, sodium hydroxide, with this weak acid. This is carbonic acid. We convert it to a weak base, sodium bicarbonate, and we produce water as a byproduct. The respiratory system also helps in maintaining our blood pH. Every time we breathe in oxygen, and when we exhale, we get rid of carbon dioxide. The more carbon dioxide we have, the more acidic our blood will be. So the faster we exhale, the higher our pH will rise. The slower we exhale, the lower our pH will go. So when we are breathing, we're actually raising or lowering our pH. If you ever thought about when, and I think I talked about this in the respiratory system, if you are breathing really, really fast, you're getting rid of all that carbon dioxide. It can cause you to get really dizzy and lightheaded. So that's why they give you a bag when you're hyperventilating, so that you can maintain that carbon dioxide amount in your blood so that you can breathe normally, and it will help you to calm down. So think of that. And then the main mechanism then is our kidneys. When pH rises, we're going to get rid of the bicarbonate ions, we're going to excrete them, and we're going to retain the hydrogen ions. But if pH starts to fall, then we get rid of the hydrogen ions. Our urine becomes very, very acidic, and we take in all of those bicarbonates. And so our pH will depend, the urine pH will depend on our body pH as well. So there are certain developmental aspects of the kidneys that are anomalies. So our kidneys start to develop within the first few weeks of embryonic life. By week 8, all of our organs have started in developing. They're just going to be maturated. So we basically have a urinary system by week 8. And it starts functioning around week 13 or 14. So one anomaly is called polycystic kidney. And so I just got this picture. I found both of these off of Google Images, actually. And this is a picture of some serious polycystic kidneys. When you have different cysts surrounding the kidneys, this can be dangerous to a newborn because the kidneys won't function as effectively. Another disorder is called hypospadias. And so what happens in this disorder is the urethral opening is actually on the posterior aspect of, I'll say posterior aspect of the penis. So normally it's right here at the head of the penis. And in this case, the urethral opening is right here. And so they can do surgery typically around 12 months to fix this anomaly. We typically start being able to control our urination by around 18 months. So this is just the starting. That doesn't mean that at 18 months your child should be potty trained, but at about 18 months people typically start potty training and children can learn. In general, by around 4 years or 5 years, children are able to control urination at night as well, and they'll wake up to go pee. A common problem in children, both infants all the way up to elderly, is a urinary tract infection. Um, so this typically is associated with um, having fecal matter get near that urethra, and then in feces we have E. coli. E. coli can then get into the urethra and can cause urinary tract infections. A less common problem that we see in individuals is renal failure. So this is when your kidneys stop functioning. If you only have less than 20% kidney function, you're typically considered in renal failure, or I think it's 20% or less. And then you're going to be put on dialysis. Dialysis is basically you're washing the blood, you're getting rid of all the waste products, just like what would happen normally during urination, but now you're doing it through an external source. Dialysis can be done at your own home now. They can actually use your peritoneal membrane to run dialysis, which is kind of cool and different. I can't tell you a lot about it because I don't know a lot about it. I'm sorry, but you can definitely look that up. Dialysis will allow you to survive for a longer period while your kidneys are not functioning properly. But eventually, if you're on dialysis, you're going to be put on a kidney transplant list and hopefully get a matching kidney that will then be able to be used for you. As we age, we stop filtering properly, so the amount of filtrate becomes less efficient, which also causes urine to be more concentrated. We can, oftentimes, this concentrated urine can lead to more urgency, lead to a stronger urgency, that's what I'll say, to urinate. And sometimes this can also lead to incontinence. In men, urinary retention is common. So remember I told you the prostate wraps around the urethra. This is only seen in men since males have prostates, females don't. If that prostate enlarges, it can actually put pressure on the urethra, which causes that urinary retention, which is a very painful problem. So associated, I talked about some of these already, but we'll just talk quickly again. I'll just mention urgency is a feeling that you have to pee. Frequency is the voiding of urine in small amounts multiple times. Nocturia is having to get up at night to urinate. Incontinence is loss of urination control. And urine retention is the inability to urinate, typically seen in males because of hypertrophy of the prostate gland. So at this point, you should be able to tell me how kidneys help to maintain acid-base balance of the blood. What is an acid? What is a base? And what is a buffer? How does the respiratory and renal system function in maintaining pH, which I kind of talked about? What does control, or when does control of urine occur? What is nocturia? What bacteria causes the majority of our UTIs, which I mentioned? What is incontinence, and why do males suffer from urinary retention? So I'm going to stop this. I'll get these pulled through Edpuzzle, and then I will upload them to your Moodle or Canvas, okay? Bye.